Here's my good friend, Dr. Joe Congidi, Sports Medicine Center, Akron Children's Hospital, part of this WA Care Morning Show for over 25 years. Joe, what do you have on your mind today in the world of sports medicine?
Well, you might guess that a lot of people were paying attention to the Cavs, and
Yes.
I really think, Ray, that I might just skip this segment today. It's just too painful. I mean, even with sunshine and the forecast and everything, it's just I'm kidding, but our fans just go through so much, and we have such great fans. They're so loyal and they care so much. That was really a hard NBA basketball playoff game, which was so important last night to watch. And, of course, it did have a lot of sports medicine running through it, right? And so the biggest questions, Ray, that I answer really about any of the players, I don't see the players, but just what might be going on and what might be, who might be back of these three players. Oh, my gosh, the Cavs had a great season all year and stayed pretty healthy. And then three significant injuries, a couple of all-stars that didn't play, and we still almost pulled out that game, and so very hard to watch. The watch word really, we don't know. I haven't seen the athletes, but these sound to be day-to-day, but they're not simple injuries. They really aren't as we look in from the outside. And the real question is, number one, everybody asks, will they play? And even more important is, will they be effective? So some of these injuries are really hard in the sport of basketball to play successfully with or effectively with. And if they're not effective, then you have to go to the next person up on the bench. The one that everybody's asking the most about, that we understand the most about, and we haven't talked about in a long time, Ray, is Darius Garland's left big toe.
Yeah.
Great toe, we call it. And it's a pretty common sports injury, and it is one that occurs. We see it all the way high school, college. It's a very common injury, although a lot of people don't hear about it. We were told that it's not a structural injury, so it's not like a fracture where he's done for the year and he's in a cast and all that kind of stuff. But there has definitely been discussion that he has swelling and pain and all the typical issues, weakness, inability to push off. And so when you can't push off, you can't effectively jump or pivot or turn. All that at the high level of what they play in the NBA basketball really makes it tough to play that game. One of the other things we don't know, Ray, in not seeing him is many, many people who play a career in these kinds of sports with a lot of explosion and push-off and cutting have chronic injuries. So they may have, this may be a brand-new injury for Darius Garland, or it could be a lot of scar tissue from years of playing the sport, or it could be even to the point of arthritis, which I have some arthritis in that joint. It's a common injury to have arthritis and scar tissue in people that have played a lot of this sport. So the treatment once you get to this stage is not the greatest. So we're trying to reduce swelling. Injections may be a role. Physical therapy 24/7 is definitely a role, trying to get that swelling down. Taping has traditionally, for a lot of our high school, college, pro players, taping it to try to give that joint some support. A stiff toe box shoe, but then that limits your mobility if you wear one of those real stiff shoes where the toe box is stiff, so there's not pressure on that joint. Because the problem with this, known as turf toe, is there's a very thick and strong ligament beneath the great toe, and it gets stretched and torn, and it develops scar tissue in it, and you just can't push off. It's loose. It's painful. And so it's known as turf toe, and it is really difficult. There's other parts of this joint that are complex, too. There's two little bones that are known as sesamoid bones. They're about the size of a peanut, and they're kind of like a pulley underneath the great toe to move the great toe back and forth. And when there's injury to the sesamoid bone and injury with tearing or scarring or stretching with swelling, then you can't move your toe very well, and it's very hard to push off. So whether this is more so in that big, strong ligament and it's turf toe, or whether it has a component to those two little peanut-sized bones called the sesamoid, we're not really sure, but we know that He's tried to go back out at least twice this week and been unable to, to be effective. And until he's effective, he's not going to be able to play very well in games. And so the real question is, a lot of people minimize it, say, hey, come on, it's a great toe, get out there and play. But the real question is, what's your performance level? Are you going to be able to perform at a high enough level to be a high-level NBA? 80%, 70%, 60%, 50%, you're not going to be able to help the team. So it's really a matter of testing and treatment and seeing what the performance level is. And one final thing you and I always kind of like doing at our age range is talking about the history. The history really of turf toe started in the 70s when they started putting turf on a lot of football fields. They would put that hard turf on the field, and as football players would push off and cut, they would tear that ligament quite frequently, and turf toe was a very common injury. I have to admit we've done a better job in the last 40 years preventing it some by some of the footwear and other things, but we haven't done a great job when it is acutely injured, when it's a new injury like Darius Garland, in really doing a lot to get them back quicker without just healing that. And historically, of course, the person who's known the best in our region is a guy who was the star of Kent State, superstar at Kent State University and in Portage County at Crestwood High School, and then in the Hall of Fame for the Steelers. It ended the career of Jack Lambert. And Jack Lambert right now, 72 years old. He couldn't play anymore with a significant turf toe. So that's the historical perspective, and that's the overall perspective of whether he can play or not, is can he be effective and can he help the team? And that's what they're trying to determine in the next 48 hours.
You know, Joe, not only Jack Lambert, but if you go back not too distant of a future, and his name has certainly been in headlines, that turf toe also ended the career, really, of Deion Sanders in the NFL.
It did. Primetime had a very significant turf toe, and that did come up a little bit in some of the recent discussions about his son in the last week or two. So there's several, if you really look beneath the surface. But so many people, it's so hard to understand how something is small, as a great toe, come on, we got to be able to play through this. Yeah. But the performance level of these athletes, is off the charts, Ray, and it's really hard to get their performance back until you get some healing in that toe.
Joe, not to put you on the spot, but with Mobley and Hunter, I'm understanding Mobley has a little bit of a sprained ankle. What about Hunter? Did you hear anything there?
Yeah, Mobley's is a sprained ankle, and you know how we jump on those with therapy. He's probably getting several time-a-day therapy. I heard he tried to run yesterday. He just couldn't push off and run and jump. I'd say, though, with ankle sprain, a chance there, taping, bracing other with Evan Mobley. I have some hopes there. I don't know, because ankles, we do a really good job with rehab. I'm a little bit more concerned about Hunter. I mean, that was a really rough play under the basket. He landed on the thumb, and I'm told, the reports say, and I read several reports, that he dislocated his thumb. So unless he's had a previous dislocation, if he has a new dislocation, gosh, ball handling is going to be very difficult with that right thumb if he dislocated the thumb. And again, the extent of how bad he may have injured that thumb, we just don't know that. And so we're back to the old day-to-day, and we're at the mercy of kind of hearing what the medical teams tell us, and everybody's dialing in, trying to find out if we can get any further information. We get an extra day this week, and the next game is Friday, and we'll just have to see on Friday. But I'm a little bit more concerned about that thumb injury with Hunter.
All right, great stuff this morning, Joe, and so timely and really concerning for all of us Cavalier fans watching those three studs on our team sit there in street clothes last night, and not only having them out of the lineup, but then you add the minutes to the guys that aren't used to those minutes, and you can see that really have an effect on the team there in the fourth quarters. They just kind of ran out of gas, even though Donovan Mitchell was playing his heart out. They just didn't have enough.
Oh, my gosh.
They just didn't have enough,
And running out of gas. but also that what was so beautiful all year was the timing and all that kind of stuff. And so much of that's disrupted when you take one guy out, let alone three people. And so we didn't have that look that we've had all year long of the beautiful timing and playing the way we play. And yet still a really valiant effort last night. I have to say that.
Yeah, they played really hard. Joe, great stuff this morning, my friend, and we'll do it again next Wednesday. Thank you.
All right. Thanks a lot. Hopefully better news. Have a great
You too. I agree. Dr. Joe Congeni's been part of this morning show for over 25 years, really laying it out there with the toe injury to Garland and, of course, the sprained ankle with Mobley and the thumb there with DeAndre Hunter.